Welcome back to the Menopause Coach Podcast. With me, as always, your host, Adele Johnston, your menopause coach and educator for the next 20 minutes or so together. Now, you are well versed in these episodes right now, but I do need to put in a little small disclaimer that this is not meant to replace any medical information or guidance for you. So please do always seek your own medical care and guidance. The episodes are here for your entertainment, education purposes only, but they are not formally educating you or certifying you in any way, mean or form. So let's jump into this episode together because this one has sat very close on my heart for a while. And when we talk about being sick of waiting and being underdiagnosed for centuries, I know for many of you, you know exactly what I'm meaning. But we're going to cover some of these really key areas right now. There is a phrase that I keep coming back to. Sick of waiting or sick waiting. And it's got so many meanings attached to it when we talk about this, because this is exactly what is happening and has been happening for centuries. Sick waiting, sick of waiting, getting sick when waiting. Women have been getting sick whilst waiting for years. Waiting to be believed, waiting for answers, waiting to be taken seriously, waiting for appointments, waiting for any type of really, really solid research to be done in women's health and menopause specifically. And at the same time, as a result of that, we've been getting sick of waiting along the way. Now, for healthcare as a system, wherever you are in this big, beautiful world, if we're honest, it's never ever been built specifically for women. Now, when we talk about even in the UK, the national healthcare system, this in itself, I've covered in many, many episodes before, is not a healthcare system. It is a critical illness or a reactive mechanism for those that have become very unwell. So it's not about healthcare specifically, it's about that ill health system. It was never taken into consideration or built in mind for everyone. It was built for the privileged white man. And whilst this isn't about bringing that really heavy negative lens of blame, it's about how we look at, well, what was the design initially made for? And has it ever actually really changed? If we think about human bodies, it's treated the male body as the default. All the research that we've had, and maybe saying all is a bit underrepresented now because we do have a lot more stepping into the space for female health. But when we really look at the grand scheme of this, it was all put together in the space of the default male body for blood results, for research, for medications, for dose of medications, and we've not had that variation then applied when it comes to the female form. So I want to look at this in stages. I want to look at this as the core problem that we're seeing as being quite clear and simple. And for decades, most medical research that has been done on men was looking at how a certain condition or situation affected the male body, but not then repeated and looked at for the female form. And women massively excluded, even in today's research fields. Hormones were always seen as just being too complex, and I've spoken to many researchers who have said the same, that it does become very challenging to look at it through the female lens, and I do appreciate that. I'm not someone that sits here and says, rubbish, of course you can do it. I appreciate it takes longer, it needs more investment, and it is a lot more complex. We've got things in there where when I was researching this to look at, well, why did we inevitably just say, we'll stick with the male body and do the research there? It became quite evident that actually this wasn't all to do with just excluding the female form. It wasn't understood. And because it wasn't understood, there was almost an area in here that was very, very grey around reproductive risk. If there was to be some research done that created problems there. Now, I'm not going to say that that's why it's not been done, but we have to look at why were women left out entirely of some forms of research, and why, in today's day and age in society now, is that still the case? We've almost built this default research trackway that excludes females along it. The gap has been created, and there's been a huge underserving, underrepresented, underdiagnosed, undersupported in the gaps of data and the gaps of knowledge and understanding, and in the gaps that still exist today where women do not feel heard or seen. So when we talk about this in healthcare form, we've never had equality when it came to the support that is available. Women over the centuries have almost been kind of shoehorned into a system of ill health response. I'm being very mindful with my language, because it's not a healthcare system. It was designed around acute illness. Now we're often starting from that type of system where we've never been included in the first place. So we don't really have that platform of, okay, yes, it's this if you're in a male body, and okay, yes, it's this if you're in a female form body. So I want to look at this from a real world impact, because this is almost the part that I want you to really be present with me on. As always, I'm not just here to bring you insight into, there's all this like disparity and this lack of support and these problems that exist. We're here to look at, okay, so what are the problems and what do we know? And what do we actually have at our forefront, fingertips, steering wheel, hands on the steering wheel that we get to drive? What does the gap actually look like in real life? It looks like pain not being taken seriously. And we've heard this talked about for years now, but nothing really truly being done. It looks like women being more likely to have certain symptoms dismissed as stress or anxiety, or it's just your hormones, it's where you are in your cycle, it's hormonal. This is where the gaps exist. For if a male was to present with many similar findings, because the research has been done and the support is in place, they would be taken seriously quicker and they would be given support and resolve. For women, we're more likely to be dismissed. We're more likely to have it written off as it's just you're too busy. It's just you're stressed. It's just hormonal. And we wait longer for that relief, whether that be through pain relief or whether that be through support of relief than men do. It looks like years without answers. It looks like certain conditions that we know names for but don't know enough about, like endometriosis. Taking years, if not sometimes close to a decade, for women to even get a support through diagnosis. Not because it's rare, I want to make that point. Whilst it won't happen to every woman, it's because it's massively under-recognised through research, through health support. It looks like living with things like polycystic ovary syndrome, PCOS, and being told to just, there's nothing that we can really do for that. You need to manage it, in inverted commas. Because without the deeper investigations and understandings of these types of conditions and the symptoms that are faced, women are proportionately under-supported, underrepresented, and left very much with we're sorry, we don't know what it is. Here is either a prescription for something that will support with the pain, and it's not okay. It looks like heart attacks. This was one I had a conversation with someone about very recently, where her own suspected heart attack symptoms were missed. And I don't say this to scare anyone, because I'm very mindful of that. But because the symptoms that women experience don't match what the doctors were trained to look out for, because doctors were trained to look out for the heart attack or cardiovascular related symptoms in men, and women do not present in the same way. Let's just take a lens on this one for a second. We think about this as the Hollywood movies, the clenching of the chest, the not being able to breathe, the falling to the floor in such pain. Yeah, the dramatic nature of a Hollywood movie. But actually, that whole intense chest pain or pressure that men can experience, maybe the left arm pain or the jaw and neck pain that they can have at the same time, the whole finding it difficult to breathe, going clammy, pale and sweaty and getting a bit disorientated. Yeah, that's what they're trained. Doctors are trained. It's what we're all trained in a way to look out for, made aware of the signs of heart attack. But this is where we get it wrong. And it's not because we've done anything wrong. It's because for women, it can look entirely different. It's so much less obvious. Sometimes women don't actually get any chest pain. Sometimes we don't even get any pain at all. Sometimes it can be extreme fatigue sometimes even days before the actual attack itself, but extreme fatigue. I'm not just meaning that you're a bit like, oh, I'm really tired today. Like you are exhausted. You cannot function. Yeah. Potentially couch or bed bound. You may have nausea and or vomiting at the same time. Again, thinking that to yourself, I've maybe just eaten something or I've just picked up a bug or something along those lines. It's come out of the blue. Maybe you do have a bit of discomfort, but it's not sometimes as severe as I've got a lot of pain and need some medication for that. Sometimes it can be a tightness or a stiffness in the neck or the back or the shoulders. A shortness of breath can happen, but again, particularly at times where we're maybe doing things, and we might get a little bit dizzy or lightheaded, but put that down to the fact that we're maybe a bit tired or, we've got up too quickly or we've just come out of a bath and it was a bit too hot. So we as women will inevitably always look at something we face in the physical or emotional form of ourself, and meaning like symptoms of something, and we will think about it is just because I had a busy day. It is just because I've been stressed. It is just because I haven't eaten for a while. So inevitably we turn to, problem solve it myself. We've almost been conditioned to go into this has happened because I. Yeah, I was talking about this with a client recently, because when we recognize the language we use, sometimes we won't say it's just because, but sometimes we'll say I. Yeah, I had a busy day today. I didn't sleep well last night. I have been a bit mindful of my HRT's being a bit off, or I didn't get my prescription on time, so I've been a bit slow in applying my HRT. These are just some examples. Inevitably, it always comes back to us saying, it's just because rather than thinking, wait a minute, this isn't normal for me, and actually this might be something I need to go seek some help for. But then we're met with the other barrier, aren't we? The help. What is that? Where do we get it? And what does it look like? Because actually, for many of us, and on the whole concept of what we've just shared in the example of heart attacks itself, and we think about it, presenting very differently in women. And yet, when were you ever explained this? Is this the first time that you've actually even heard this today? Yeah, have you ever been told that these are the signs and symptoms for females, for women, for potential heart attacks? We're taught that heart attacks look like that clutching of the chest and collapsing to the floor in this dramatic, like I say, Hollywood movie style. But actually, that's not how it can happen for women. It doesn't look like that at all for many women, if any. Yeah, it can feel like, I've said, exhaustion, nausea, a little bit of neck pain, something just being a bit off for you that you're like, I just don't feel well. So because it doesn't match the textbook of what the medical teams, more so GPs, have been trained upon, it gets missed. There are probably many women out there who have had mild heart attack episodes and actually have put it down to something else and got on with life. But these are the hidden risks for many women. And the cost of it, for me personally, I feel very sick about it all. Sick in so many ways. I'm sick about it, as in I'm tired, I'm done, I don't want this to happen anymore. And also, I recognise that so many of us, myself included, can actually get quite unwell in the form of the other word of sick. We can get unwell as a result of being dismissed, of being underrepresented, under-researched, and misdiagnosed and underdiagnosed. Waiting for things, I want to look at it through it's not neutral territory. We as human beings are quite impatient. I know that because I am an impatient human. Really impatient. When someone says to me, be patient, it really triggers me because I'm like, I am not patient. But it also, we've got to think about, if we are becoming quite dismissed, we do become in our own way dismissive of our own symptoms. And that carries its own risk of consequence. Conditions that we have as women can become worse because we leave them. Use me as an example of this. Recently, and I say recently because it's taken me nearly 8 months to get help for this, but recently I got diagnosed with suspected frozen shoulder starting. I just had a bit of a problem with my left shoulder. I've recognised that when I'm lying in bed, if I roll over on that side, it is excruciatingly painful. I've lost some of the power in that shoulder, some of my mobility in that shoulder. And I actually put it down to the fact that I'd maybe injured it when I was working out. So I thought, give it 6 weeks. If it's a tissue injury, it will within 6 weeks be okay. I've had these minor injuries over the years from training anyway. So yeah, left it. But then 6 weeks became 6 months. What is wrong with us as women? I'm one of you, right? That leaves it, that puts everyone else ahead of ourselves at times and thinks it will just get better on its own. 1, I don't want to have the rigmarole of trying to make the appointment. 2, they're probably going to tell me there's nothing they can do, yada, yada, yada. So we talk ourselves out of the support and we allow conditions to worsen. For me, potentially, I wouldn't be facing the starting of potential unsuspected frozen shoulder and now needing, to go for a cortisone injection in it so I can actually start proper therapy for it, treatment and therapy, which is probably realistically going to be at least another 12 weeks of that or more, maybe 6 months, who knows. But I share this with you openly because as a woman, I've been there. The pain has become really severe for me and it's not helping me sleep. So we get diagnosed later because we don't step forward into our own care. And this is important. So there is a huge cost to all of this. The kind of experiences that we go through as women when we think about the impacts of this, eventually, we're the ones who bear the brunt. So I want to know, from my perspective and yours, with what I've shared today, why do you think this is still happening? I want you to really think about it. Yeah. Part of it is data, we don't have it. Part of it is research because we don't include women fully. And either as well, because we've already built a system where people just follow. It's like, well, we just don't include women in that. We never have done. We've almost become invisible in a sense. Our entire systems for health have been built on incomplete data. We've been invisible through the journey. But there is a movement now. More awareness, more research. I'm part of it at Stirling University right now for psychology and menopause. It's not easy. And you can see why a lot of people tap out, but this truly matters. Because systems only change when enough people stop accepting them. And I would love for you to be invited to be one of them. Because if you've ever felt dismissed, or like you've had to fight to be taken seriously for things, then I promise you're not imagining any of this. And 110% you are not alone. If I've shared anything today that has really got you thinking, and you're also sick waiting, then it needs to end. And we get to be part of that process of helping it stop. Because silence is never an answer to this. So when we get to ask more questions together, please drop in support@AdeleJohnstonCoaching.com. Ask questions. Let's look at how we make a difference and make a change in this space, because this is all of our futures. And when we push for better, when we actually get treated properly, then things will change for our next generations to come. I really want this to be seen and understood, not just heard. I make an invitation to you listening to this right now to have a think about what this episode has sparked for you. And if you're someone who truly wants to step forward and make a difference, then you have an opportunity. As you know, I operate a Menopause Academy. And inside that academy, we train individuals like yourself to become menopause specialised. And I would love to make an invitation for you to just get curious on that. If you too would like to become menopause trained, then reach out and ask for our course syllabus, and we'll be able to talk you through that. This is always a pleasure every week to come here and share these episodes. But I would love to know what you would like to hear next. So if you are listening to this right now and thinking, I would love to hear more Adele on a specific topic, then please let me know what you want to hear next. I am here every single week for you, with you, and together we are all making menopause mainstream. So go share this episode with someone else and help this grow. I appreciate you, and I will see you next week.